Okay, this video is called "Is the Blood Safe?" with regard to blood transfusion. And the reason for this lecture is I know a lot of people, they almost think it's a rite of passage that when you're in your mid to late 50s, early 60s, you're supposed to get open heart surgery, and if your knee arthritis is acting up, you're supposed to have a knee replacement. And what I'm saying is, we've obviously talked about it in other lectures that low fat, low sodium vegan, you can really, based on the Esselstyn diet data and Ornish, really dramatically prevent coronary artery disease, and you dramatically improve arthritis, all the work of Dr. McDougall, etc., and others. But anyways, just with regard to blood donation, when I was a young guy, I was always taught, well, you can't donate blood unless you do it for free. But nowadays, they're paying blood donors a lot of money. This is a real famous Octa Pharma Plasma place. And you go right to their website, and it says in the first month, you can earn over $500 in the first 35 days. And I've also seen donors talking about donating routinely twice a week, incredibly frequent. Normally, you would think you wouldn't donate blood for a long time. It depends on the amount they're taking, but it's worrisome when you start paying donors to donate blood. The reason is, what you get then is, if you don't pay, you just do it out of the goodness of their heart, so to speak. You get wealthy people who want to do it for altruistic reasons. But when you start paying a significant amount of money, there's a lot of people who are, starving, very poor, below the poverty line. And for them to get this type of money, that's big money. That's more money. They can't get a job. And so they're doing that. And, drug addicts will do this. You got people, shooting up heroin and then going to donate blood. I would be worried about that. There's a lot of people who on the internet say they're supporting themselves financially by donating blood. So that creates tremendous incentive to donate more often than one should. And at some of these places, they're only clearing the patients primarily based on a kiosk of questions, rather than, a physician careful history and physical. Now, a lot of the blood donation risks are relatively uncommon. The risk of HIV is 1 out of 1.5 million, so that's pretty good odds. Hepatitis, 1 out of 300K for HBV, 1 out of 1.2 mil for HCV, hepatitis C versus hepatitis B. West Nile, 1 out of 350K. So they're pretty uncommon, the infection risks. How many people die? 1 out of 130K for RBC transfusion, 1 out of 37K for platelet transfusion. All I'm saying is I would do what I could to avoid it. And the other thing that's of concern, this guy right here, Douglas Kell and Etheresia Pretorius, they're geniuses. If you study blood pathophysiology and blood clotting and atherosclerosis and autoimmune disease, you'll come across their literature. They've written a lot of magnificent papers. They both deserve Nobel Prizes. Okay, like one of my favorite papers by them was Iron Behaving Badly, where they go through the oxidative stress and the pathophysiology of prion diseases, of amyloidogenic blood clotting. Very interesting stuff. But the reason why I mention all that stuff is they have shown that bacteria in blood is much, much, much more common than was previously recognized. And a lot of times it wasn't recognized previously because they weren't doing anaerobic cultures and they weren't testing for dormancy. Basically, a lot of bacteria can remain dormant in the blood and simply be reactivated when there's available free iron, non-transferrin bound iron. So it was also the thing that I remember when I started out in medicine. There was a lot more enthusiasm for blood transfusion, and then over the years they found it doesn't work as well as expected, and I think this is a big part of it, these dormant bacteria and reactivation of bacteria due to an increase in the amount of free iron. So nowadays, they still transfuse when they need to, but the thresholds are higher than what they used to be. So all I can say is, if you can resolve your knee pain by lose the weight, minimize the inflammation in your body, that'd be a way to help decrease your risk of potentially needing a blood transfusion. And I would be less confident in the transfused blood nowadays that they're paying big money for blood donations than they used to be in the old days when it was done for free.